let me explain few question and answer about physiological adaptation. This is NCLEX licensing exam practice question. The first question here, a client who had intracavity radiation treatment for cervical cancer 1 month early. She reports small amount of vaginal bleeding. This finding most likely represent for what? Option 1, recurrent of the carcinoma, development of rectovaginal fistula, and expected effect of radiation therapy. Number 4, infection secondary to a change in vaginal flora. The correct answer is, it is an expected effect after the radiation therapy. So a client who had cancer and the treatment is radiation, and radiation therapy have some side effect, right? So it is expected effect of radiation therapy, maybe vaginal bleeding. The rationale after radiation therapy, some vaginal bleeding occurred for 1 to 3 months. Intermittent painless vaginal bleeding is a classical symptom of cervical cancer. But given this client history, bleeding is more likely a result of radiation because this patient has a history of radiation treatment. The passage of feces through the vagina, not the vaginal bleeding, it is a sign of rectovaginal fistula. So number 2, development of rectovaginal fistula. So it is not related to the vaginal bleeding. And vaginal infection are indicated by various type of vaginal discharge, not the bleeding, like infection secondary to the change in the vaginal flora. It is the infection. In this picture, we can see the tumor in the cervix, right? So let me talk about, so who are under the risks to develop cervical carcinoma or cancer? The person who have a multiple sexual partner, if the person has a habit to smoking, or long-term use of oral contraceptives, or sexually transmitted disease for a long time that is untreated, they are under the risk. The basic sign and symptom of cervical carcinoma: pelvic pain and back pain, vaginal bleeding, or pain during the sexual intercourse. And how we can prevent it, and what are the treatment options? So you see here human papilloma virus. So it is the main culprit of cervical cancer. So treatment is vaccine against the human papilloma virus, chemotherapy, surgically remove, and radiation therapy. And in the last picture showing the normal cervix, early stage of tumor, late stage, and stage 2B, it is expanded. Next question here. A client is admitted to healthcare facilities for evaluation for Addison disease. Which laboratory test result the best support a diagnosis of Addison disease? So we know that Addison, the spelling is here A-double-D. So D for down, right? D for down. So in or D for decrease. So in Addison disease, the corticosteroid or steroid hormone from adrenal cortex should be less or down. Most of the sign symptom, if we go, we can see they are go to down, reduce, except potassium. So this question, they said, what are the diagnostic test? Blood urea nitrogen, BUN level 12 millimeter. Number 2, blood glucose level 90 milligram per TL. Serum sodium level 134 milliequivalent, and serum potassium level 5.8. So which laboratory test result best support to diagnose the Addison disease? The correct answer is serum potassium level 5.8. So rationale, Addison disease decrease the production of steroid, cortisol, androgen, and causing the urinary sodium or fluid losses, and increase the serum potassium level and hypoglycemia. Therefore, a elevated serum potassium level 5.8 milliequivalent the best support a diagnosis of Addison disease. BUN level 12 and blood glucose level 90 within the normal limit. And in a client with Addison disease, the serum sodium level would be much lower than 134 milliequivalent, nearly normal level. So basically in this 4 option, the blood urea nitrogen within the normal limit, blood glucose level 90 within normal limit, sodium level close to normal. I said easy way to remember, Addison disease, the pronunciation, the spelling is ADDISON, D for down. So decrease, D for decrease or D for reduce, D for down, the production of steroid hormone. And most of the electrolyte, glucose level, everything is go down except potassium. And here we can see potassium is little bit up. So it is the diagnostic marker that support patient has a Addison disease. Next question, a client with hepatitis C developed the liver failure and GI hemorrhage. The blood product that most likely brings about the hemostasis in the client are. So patient who has hepatitis on the liver and GI bleeding. So this is blood product that most likely bring. So number 1, whole blood and albumin, platelet and pegged cell, fresh frozen plasma, and whole blood, and cryoprecipitant and fresh frozen plasma. The correct answer is number 4, cryoprecipitate and fresh frozen plasma. So if anybody has a liver disease, chronic liver disease, so liver does not work, and liver can produce the protein, and protein is important for maintaining the pressure, oncotic pressure, and also they can help to the transport system. So the number 4, they said precipitant. What does it mean? It is a substance that precipitates from a solution, especially from blood. So rationale is the liver is vital, the synthesis of clotting factor. So clotting is a protein. Clotting factor is a protein basically, and protein produced in the liver, so that it is decreased or dysfunction as in hepatitis C, bleeding occur. So clotting factor help to blood clot. If liver does not work, clotting factor will not produce, and lack of clotting factor lead to the bleeding. So patient has a GI hemorrhage, means bleeding. Treatment consists of administering blood products that are aid the clotting factor. So fresh frozen plasma contain the clotting factor. This produce include fresh frozen plasma containing fibrinogen and also cryoprecipitant, which have most of the clotting factors. Although administering whole blood albumin packed cell will contribute to hemostasis. This product are not specially used to treat hemostasis. Although platelet may be helpful, the best answer is cryoprecipitant and fresh frozen plasma because they contain the clotting factor. A client with a Paget disease. So, and a patient come to us with a Paget disease to the hospital and complain of difficulty of urination. The emergency department physician consult urology. What should the nurse suspect is the most likely cause of the client urination problem? So first of all, the key point is here, Paget disease. It is also known as osteotitis deformans. Paget disease is a condition which disrupt the body's normal bony recycling process. It commonly occurs in the pelvic bones, skull, or the spine and legs. So when bones is broken, the calcium came out and calcium precipitated in the stomach, kidney, and formed the stone or calculi. So number 1, renal calculi. Number 2, urinary tract infection. Number 3, benign prostatic hyperplasia and dehydration. So when you read this question, the examiner make it easy for you. Examiner makes it easy for you because mentioning the Paget disease, and also there are no sign of urinary tract infection. There are no sign and symptom of benign prostatic hyperplasia. Even question does not mentioning man or female. No urgency, frequency, dropping of urine, and also no sign of dehydration. So Correct answer is renal calculi. Rational. Renal calculi commonly occur with Paget disease, causing pain and difficulty with urination. A urinary tract infection or UTI commonly causes fever, urgency, burning, and hesitation with urination. Benign prostatic hyperplasia is a common in men older than 50. However, because the client has Paget disease, the nurse should suspect renal calculi, not the benign prostatic hyperplasia. Dehydration causes a decrease in urine production, not a problem with urination. Next question. A nurse is caring for a client who underwent a subtotal gastrectomy 24 hours ago. The client has a nasogastric tube. The nurse should apply the suction to the nasogastric tube every hour. Clamp the nasogastric tube if the client complains of nausea. Irrigation the nasogastric tube gently with normal saline solution if ordered, and reposition the nasogastric tube if pulled out. The correct answer is irrigation the nasogastric tube gently with normal saline solution if ordered. The rationale: the nurse can gently irrigate the tube if ordered, but must be careful not to reposition it. The repositioning can cause the bleeding. The nurse should apply suction continuously, not every hour. The nurse should not clamp the nasogastric tube post-operatively because the secretion and gas will accumulate, or tracing the suture line. So this question, every hour, because of this, number one is not an answer, because suctioning will be continued. Clamping the nasogastric tube if complain the pain. So nausea, if nausea is not a cause of clamping, need to clamp. And also response the nasogastric reposition. So we will not reposition it. We are not a physician. And also reposition can cause the bleeding. Our patient came from operation theater after subtotal gastrectomy. So because of the problem, the part of the stomach is cut and removed, maybe because of tumor. So it is called subtotal gastrectomy, remove the part of the stomach, right? So after the surgery, we give the rest to the GI or stomach. How we can give them rest? By nasogastric tube, not to eat anything through the mouth, feeding through the nasogastric tube. Next question here. A client with chronic sinusitis come to the outpatient department complaining headache, malaise, and non-productive cough. When examined the client paranasal sinuses, the nurse detected the tenderness. To evaluate these findings further, the nurse should trans-illuminate the Transilluminate means take the radiology or examination. Frontal sinus only, sphenoid sinus only, frontal and maxillary sinuses only, or sphenoidal and ethmoidal sinuses. Our correct answer is frontal and maxillary sinuses. In this picture, anterior posterior view, we can see the frontal sinus here, this one, and this is the maxillary sinuses. So this is the biggest sinus out of all. So this is the ethmoidal and sphenoidal, very small and complicated. What are the function of these sinuses? They lightening the skull. They help to phonation. They helps to drainage, right? It is the lateral views. We can see the sphenoid sinus and ethmoidal sinus, frontal and maxillary. So when you take the radiology or any examination, these two sinuses will be visible and you can catch it easily rather than the sphenoid or ethmoidal sinus. So our healthcare provider, if want to evaluate transluminally, frontal and maxillary sinuses. Rationale: after detaching the tenderness of the paranasal sinuses, so all of them together is called paranasal sinuses. The nurse should transilluminate both frontal and maxillary sinuses. Lack of illumination may indicate sinus congestion and pus accumulate. The sphenoidal and ethmoidal sinus cannot be transilluminate because of location. Next question. A client with a lung cancer developed the Horner syndrome. So Horner syndrome because of the lung cancer. So when the tumor invade the ribs and affected the sympathetic nerve ganglia, when assessing for sign and symptom of this tumor, the nurse should. So first of all, the keyword here, the patient developed the Horner sign or symptom because of the lung cancer, right? So now question is here, when assessing the sign symptom, which are the sign symptom of the Horner's cancer? So the nurse should know here: meiosis, partial eyelid ptosis, or chest pain, dyspnea, cough, weight loss, and fever. Arms and shoulder pain or atrophy of the arm and hand muscle. Also, hoarseness and dysphagia. The correct answer is meiosis, partial eyelid ptosis, means eyelid fall. Also, ehidosis of the affected side of the face. The keyword is here, the Horner syndrome, because of lung cancer. So question come, what is Horner syndrome, right? So when cancer in the upper part of the lungs or apex of the lungs and it sometimes called Pencrost tumor. And this tumor are more likely to be non-small cell lung cancer than the small cell lung cancer. And Pencrost tumor can affect the certain nerves in the eye and part of the face and causing a group of symptoms basically. So let me read the rationale. Horner syndrome, which occur with a lung tumor, invades the ribs and affected the sympathetic nerve ganglia, is characterized by Horner syndrome because of the lung cancer. It is also sometimes called Pencrost tumor. Lung cancer or Pencrost tumor or Horner syndrome can affect certain nerves to the eye and part of the face. So we can see, and causing a group of symptoms together is called Horner syndrome. What is this group? Group of symptoms like miosis, partial eyelid dropping, ptosis, or ahedrosis of affected side of the face, chest pain, dyspnea, cough, weight loss, and fever are associated with the pleural tumor, not the Horner syndrome. Arms and shoulder pain, atrophy of the arm or hand muscle on the affected side suggest the Pencrost syndrome or lung tumor involving the first thoracic and 8 cervical nerves within the brachial plexuses. Horner syndrome is a client with lung cancer suggests that the tumor has extended to the recurrent laryngeal nerve. The dysphagia suggests the lung tumor is compressed to the esophagus. So lung tumor get involved what structure, and this structure related complications start. Next question here. A client with gestational hypertension is likely to exhibit. So the keyword here, hypertension, but hypertension is developed because of pregnancy, gestational. So is likely exhibit what other sign? Proteinuria, headache, and vaginal bleeding. Headache, double vision, and vaginal bleeding. First of all, number 1 and 2 is not an answer because of vaginal bleeding. My patient has a gestational, so pregnancy. When mother is pregnant, no bleeding at all, if everything is okay. So always I prefer my student just follow the rule of 9. Rule of 2. What is rule of 2? The 4 option, just kick out which is not an answer. Then just think out which out of which 2 answer would be. Just focus on it. Proteinuria, headache, and double vision. Proteinuria, double vision, and uterine contraction. So in these 2, number 3 and 4, common is proteinuria. Double vision. Now confusion about headache and uterine contraction. So the correct answer is here. proteinuria, headache, and double vision. Rationale: a client with gestational hypertension typically complain of headache, double vision, or diplopia, sudden weight gain. Additional findings: proteinuria means protein present in urine. Vaginal bleeding or uterine contraction are not associated with a gestational hypertension. And gestational hypertension, if do not treat, it leads to the pregnancy-induced hypertension, or it leads to the pre-eclampsia and eclampsia. Next question. When providing discharge teaching to a client with a fractured tooth, the nurse should include which instruction? So big toe, the foot is fractured. What should be the instruction? Apply heat to the fractured side. Apply ice to the fractured side. Perform ankle dorsiflexion 3 times a day. Use the crutches for a week. So if my grade 2 is broken in the feet, do I need to use crutches for a week? I do not need. Only the grade 2 is fractured. And when anything is fractured, immobilization is important. Do I need to perform dorsiflexion 3 times a day? I need immobilization. Fracture is occur, my blood vessel inflamed or ruptured. So you need to stop the bleeding. You need vasoconstriction, and vasoconstriction occurs by heat or by cold. You have to think and then go for the answer. So the best answer is here. Apply the ice to the fracture site. Rationale: applying ice to the injury site soon after the injury causes the vasoconstriction, helping to relieve and prevent the swelling and also prevent the bleeding. Applying heat to the fractured site may increase the swelling and bleeding. Ankle dorsiflexion has no therapeutic use after the toe fracture. It is unlike the client would need the crutches after the toe fracture.